Good afternoon, everybody, and welcome to the final media briefing of the new year of 2000. Fun. Give me a right permission to record, and then we'll get started.
Recording in progress.
Everybody should now have permission to record. If you do not, please let us know in the chat. And with that, we will start in 5, 4, 3, 2, 1. Barry, over to you.
Good afternoon, everyone. My name is Barry Hudson, Director of Public Information for Montgomery County, and welcome to the last media briefing of 2021. Today we have County Executive Marc Elrich. We also have with us Dr. Earl Stoddard, as well as Sean O'Donnell from our Department of Health and Human Services. And we're also joined by Dr. Ann Burke of Holy Cross Health. In addition, we also have our Fire Chief Scott Goldstein. As we know, most of you on the media side, please make sure that you ask for permission to record if you have not already. And also please put your questions in the chat, identifying your news organization, and we will call you in turn. We have a hard stop today at 1:30. So if you have a multiple number of questions, I might cut you off, but please limit your questions so that we can get through everyone and make sure that all the reporters get an opportunity to ask questions. So without further ado, I am going to hand this over to our County Executive, Marc Elrich, for opening remarks.
So good afternoon, everyone, and thank you for joining us today. It's good to see so many people here still working and not out on vacation in this holiday week break. So good to see everybody around. Before we start our COVID update today, I just want to address the incident in Silver Spring involving a police shooting where there was a fatality. To the best of my knowledge at this point, our police responded to a shooting that preceded that in downtown Silver Spring. They identified the victim. The victim identified the car that his assailants were in. That car was stopped by the police a short distance away from downtown. And at least one of the occupants got out of the car, shot at the police officers. The police returned fire, and the person in the car who stepped out of the car was killed. Per new state law, the Maryland Attorney General's office is going to be investigating this incident. They would investigate all such incidents going forward. It's important to note that the AG's office will be responsible for disclosing any body camera footage of this shooting. So you'll be getting additional information, but the body camera footage will come out when the Maryland Attorney General's office actually releases that footage. As we wait for those details, we are addressing the rise in violent activity in Silver Spring. Over the last several months, our department has been working proactively in Silver Spring to suppress illegal activities and particularly violence. And we continue to meet with residents, business owners, and workers in Silver Spring to find ways to address the rise in crime. I'm going to be working with the council and submitting legislation that will address funding for areas where we currently do not have the budget or tools that we need, particularly regarding collecting and managing data, which is going to be critical for providing greater accountability. And additionally, we will be negotiating a new contract with the police department again to address the wage problems which leave us at the bottom of the regional police departments when it comes to pay, particularly in the earlier years of the pay scale. I will just add again that we submitted such a proposal to the council 2 years ago. The council didn't accept it. I'm glad they're all on board apparently with raising police to a comparable level with surrounding jurisdictions, and hopefully whatever we negotiate will be satisfactory and can get passed. We're also looking to support state legislation to allow the county to enforce some state regulatory rules that we think are contributing to some of our public safety issues. Obviously, Montgomery County is not immune to the rise in violence and criminal activity. It's spiked across the region, the state, and the nation, but our residents and businesses clearly don't want to hear any excuses or reasons to feel unsafe, and nor should they. So we're going to do everything we can so every community in Montgomery County is safe from violence, and that will continue to be a priority in the new year. Going to COVID, COVID cases are surging. As far as COVID, we're ending 2021 with the surge in COVID cases at a level we've not seen since the beginning of the pandemic. Our current case rate is 649.5 cases per 100,000 residents. This is 8 times the case rate we were at the start of the month. The Omicron variant is currently making up about 58% of our cases throughout the mid-Atlantic states. Our test positivity rate is currently 14.1%. At the beginning of the month, it was a mere 2.7%. This is a 6-fold increase in just 3 weeks. As you can see from this chart, we're about 3 percentage points lower than the state average, but this is a place where we did not expect to be, especially after the implementation of vaccines. The impact of this surge is on everyone, including my own family, 2 of which have tested positive and are recovering, both mild cases, nothing severe, but it's a reminder of how close to home this can be. And I'm fortunate that I've been boosted, and they were both double vaxxed and boosted. I feel fortunate that I have not come down with it yet, but it's around me and I'm well aware of what this looks like. The good news about this surge is that the severity of symptoms is such that because of the high vaccination rate, we're seeing primarily low levels of severity. That seems to be consistent with what we hear from the CDC, that people who've been vaccinated and particularly boosted are seeing milder cases. And that seems to be what we're seeing in Montgomery County, and it's certainly what I'm seeing out of personal experience. This week, the CDC revised their isolation and quarantining guidance. The CDC is shortening the recommended time for isolation from 10 days for people with COVID-19 to 5 days if asymptomatic, followed by 5 days of wearing a mask around others. However, MDH has not adopted this guidance from the CDC yet, so we'll continue to follow state quarantine guidelines until they update their clinical guidance to the CDC recommendations. The most significant impact of this surge has been on our hospitals. As you can see from this graph, Montgomery County hospitals are seeing an influx of COVID patients. They're now at levels not seen since last winter's surge. Statewide, there are over 2,000 COVID patients currently receiving hospital-based treatment, the highest volume here since January, before there were any vaccines widely available. The state numbers are significant to us in Montgomery County because when our smaller hospitals in the state fill up, those patients are sometimes transferred to our local larger hospitals. Not only are our hospitals seeing an exponential increase in patients, they're also facing their own staffing shortages. And they were facing the staffing shortages before Omicron hit, and Omicron is just complicating it with more people getting sick and not able to come into work. We expect these numbers to get worse before they get better. It's important to note that a resident should not seek routine COVID-19 testing at our hospitals or emergency rooms. Not only does it harm their ability to provide service, but also sitting in a hospital emergency room right now would not be the safest place to be unless you're actually looking to get a case of COVID. So don't use the emergency rooms for this purpose. We have plenty of sites around. We know that the lines can be long. We've had sites, our own sites, but particularly sites provided by some of our third-party partners that have run out of testing at times. But we're doing our best to maintain and increase our testing, and we've actually ordered a significant number of new tests. I'm hoping the governor will reinstate the public health emergency that the Maryland Hospital Association is calling for. This action will greatly help our hospitals in dealing with the surge. And I also agree with Tom Perez, who recently called on Governor Hogan to extend hazard pay to all of our state's frontline workforce, that the governor should use ARPA funds to extend hazard pay to non-state government essential employees, such as healthcare workers, firefighters, paramedics, and police officers. The state is sitting on a $6 billion surplus, covering hazard pay for a short period of time, which is what everybody thinks the spike is going to be, would barely put a dent in this, certainly no significant reduction of it, but it would help in keeping people in the field and coming to work. MCFRS staffing in Montgomery County. I think you've seen a release on this in the last couple of days. We've seen these COVID cases impacting our own county government. Yesterday, Montgomery County Fire and Rescue Services announced that 110 career, 23 volunteer personnel are unable to report to work, in addition to approximately 75 MCFRS staff who are unable to report to work due to their occupational health issues or injuries. So we have over 200 people not able to report to work. That seriously impacts our ability to keep everything we had operating as a result. So as a result of that, the department's experienced a 9% reduction in staff that's requiring some adjustments to meet service demands. In an effort to continue providing high quality emergency services to the community, MCFRS has taken the following steps to mitigate the impact of these staffing shortages. They added recently graduated firefighters, all who came to MCFRS with firefighter and EMT experience, to full shifts, which will augment daily staffing. We've reassigned firefighters and paramedics currently in training to their community service responsibilities. We've created an EMS disposition officer to ensure load balancing at local emergency departments. We requested volunteer partners to staff additional peak time transport units, adding additional transport capacity to the system. We've prioritized advanced life support care delivery and firefighting water delivery across the state. And we've temporarily deployed staff from one ladder truck to Clarksburg Aerial Tower and one heavy rescue unit to Laytonsville Rescue Squad. And that staff will help balance the loads around the county. And for that reason, I've got our fire chief, Scott Goldstein, on the call this morning to answer any questions you may have about the staffing shortages in the fire department. New Year's celebrations are upon us. I won't be doing any this year. As we deal with this surge, we expect that the next few weeks we'll continue to see a rise in cases due to New Year's celebration outbreaks. I hope that everyone keeps their New Year's festivities and gatherings intimate and safe. If you're going out to celebrate New Year's, please be smart. Get tested before you go out and after you celebrate. Wear masks at indoor gatherings and confined spaces where you're sharing the same air with people. And please do not drink and drive, which has nothing to do with COVID and everything to do with using common sense and making sure you come home alive at the end of the night. Our police will be out and looking forward to finding impaired drivers. On testing, this recent surge has put a strain on our testing infrastructure. There's a lot of frustration about the lack of rapid test sites, the long lines at testing sites, confusion about where and when to get appointments, delay in getting test results, and unannounced cancellations or moves by some of our partners. As you can see from this chart, our county testing sites have tripled since last month, doubled since the Thanksgiving holiday. And we ask everyone to please understand there's a rush for testing and to be patient as we continue to test as many people as fast as we can. The average turnaround for testing last week was 1.89 calendar days from testing to result. But this has risen from a steady 1 day to 2 to 3 days, and test results at the end of last week took the longest at 3 to 5 days. Our staff is working very diligently to try to meet the demand, but timed appointments are our priority, and we encourage everyone to use our county sites to make an appointment. If you are unable to make an appointment at a county testing site, please check the large number of other testing sites that are in our community, both public and private. As far as rapid tests, I'm pleased to announce that we ordered 1 million rapid tests and are receiving our first shipment of them, 300,000 of them next week. We appreciate the District of Columbia for assisting us in securing these tests. They can't arrive here soon enough. And I want to thank Dr. Stoddard and our procurement team for the diligence to try to track down and acquire these rare objects that these tests have become. We're going to make sure these tests will be given out equitably throughout the community and prioritizing our students and frontline and public safety, public-facing workers. As our schools return next week for the holiday break, I'm encouraging all parents to please get their kids vaccinated this week. And if you can, please get your kids tested before you go back to school next week. As you can see from this chart, Montgomery County is still doing better at pediatric vaccinations than the rest of the state, but we're still only about 50% of our pediatric population with their first dose, and only a third has been fully vaccinated. We need more people to come in and get vaccinated and have your children vaccinated. Our HHS team has been and is going to continue conversations with MCPS this week to get prepared for the return of students next week. They also continue to communicate with parents and guardians of students and providing as much guidance and answering as many questions as they possibly can. I'm now going to turn this over to Dr. Burke, and she'll be followed by Sean O'Donnell and Dr. Stoddard. Thank you.
Good afternoon. Thank you so much for allowing me to join you today to give a little bit of on the ground frontline experience with what we are seeing in our hospitals locally. I am so thankful to live in Montgomery County, where we do have such a high vaccination rate overall. And I do want to thank all the public health officials on this call who have made that possible and who have promoted the positive benefits of vaccination within our community, because we do see those positive effects within our hospitals. We are indeed seeing a dramatic increase in the number of individuals who are presenting either for emergency room care, for screening and testing, and then for admission. I would like to echo that our emergency rooms are open and available to take care of patients who have true medical emergencies. We very strongly encourage those who are only mildly symptomatic or who are seeking confirmatory testing only to please use the other resources that are available within the community. We need to preserve our EMS services, our emergency departments for patients who are experiencing medical emergencies. I would also like to recognize those emergency providers who are continuing to do truly heroic work through this next surge, and we are indeed in the midst of a major surge. Trends that we are seeing within our emergency departments are that of patients who are presenting to us for influenza-like illnesses, so the symptoms of fever or cough or respiratory difficulty, that about 50% of those are testing positive for COVID. The good news is that only about 10% of those are getting admitted to the hospital because they have moderate illness or greater. And fortunately, those that have severe illness are an even smaller component of that overall number. Another trend that we are seeing, which is different from what we saw in previous waves, is a significant increase in pregnant patients who are testing positive for COVID. As many of you know, Holy Cross Health has a very large obstetrical delivery volume. We have cared for patients throughout the pandemic who are pregnant and who test positive for COVID, but we are seeing a dramatic increase in the number of patients who are pregnant and presenting for care who are testing positive for COVID. Again, fortunately, most of those patients are either asymptomatic or mildly symptomatic. However, we have seen pregnant patients with severe illness. And over the course of the pandemic, that has ranged from about 1% to 3% of our pregnant patient population. Currently, in our hospitals, we have about 18% of our overall admitted COVID positive patients who are receiving critical care services. And of our total COVID positive patient population, approximately 6% are receiving support through mechanical ventilation. Those are significant numbers, but they are lower than what we saw in the previous waves. I will echo what our executive just said, which is that vaccination does work. We are seeing lower rates of severe illness. And I would just encourage everyone, if they are not fully vaccinated and have not received a booster dose and they qualify for vaccination, that they please do take advantage of those opportunities within the community. You also touched on the issues that hospitals are having with staffing, and it is a true challenge. I am so proud of our colleagues. I am so proud of those individuals who continue to show up to work, continue to do the hard work of caring not only for our patients, but also caring for each other. The staffing challenges are across all parts of our healthcare community. It includes our environmental service providers who do a fantastic job keeping our hospitals clean and safe for patient care. It includes our food and nutrition services who every day provide tasty and nutritious meals for our colleagues and for our patients. All the support services, pharmacy, lab, respiratory therapy, the great resignation that we've seen across the nation has indeed hit healthcare extremely hard. In addition, it's the holiday season. Our staff want to take time off to be with their families, just like all of you want some time off to be with your families. So it is a multiplying effect of having this wave of infections overlapping some of our major holiday seasons. In addition, there is the challenge of paying for staff. As we've seen across the country, the cost of being an employer has gone up dramatically. In our institutions, it is a factor of millions of dollars more each month to pay for staff over what we were budgeted for this year. So there is both the physical needs of staff, and then there's the financial ability to pay for staff. And it is a large challenge at this time. In addition, we too, like the fire department, are having our staff members that do test positive for COVID The majority of those can be traced back to community exposure. And we very much appreciate the revised guidelines from the CDC around a reduced period of time away from work for colleagues who are perhaps testing positive but are completely asymptomatic. And I will support, again, our executive in saying that we expect our state leadership to also support those return to work policies that will significantly help us in being able to staff our organizations. In closing, I would just like to say, please get vaccinated. Please get your booster shots. Avoid those large gatherings. Wear your mask. Sanitize your hands. And I will, as an obstetrician, I will put in a specific plea for women who are planning pregnancy or are pregnant. All of those same recommendations apply. Please get vaccinated and please be careful with your activities. Thank you.
Thank you, Dr. Burke. You saved me a bunch of time in echoing all of those remarks you just made are absolutely agreed upon from public health. I'm going to just share very briefly the updated pulse report. I know our county executive has touched upon many of the essential pieces that we have for you today. So again, I'll move through this fairly quickly. He has asked us to update this as we move along through today. So I may have one or two numbers that are slightly updated over the last half hour or so. So again, we have some reestablished feeds from the state. Not all of these have linked into the county dashboard, which is a hard-coded system so that we can provide you rapid information every day. But we are hoping that feed into the county dashboard will be updated within the next day or two. We're seeing very high and increasing daily positivity rates. These are rolling averages, 7-day rolling averages, and the county is up to 14.6, the state 17.6. This is the highest the state has had since May 14th, 2020. And again, these are just continuing to increase even as testing volumes increase. Our transmission, our cases per 100,000 over 7 days, we've reestablished that feed, and that continues to shoot ever higher, recently at 649 per 100,000. Each day we get these totals back, they have gone up considerably. Our hospitalization rate, the one update we have as we're beginning to get the updated censuses for today, we're now at 362. We do have one or two hospitals we're waiting to update their census reports. So today's number may change a little bit. But again, these are continuing to climb with inpatients. As Dr. Burke said, there still is significant capacity within the hospitals, but the number of COVID cases is increasing. This is not just individuals who are primarily there for the symptoms of COVID, but it also includes individuals who are there for other illnesses or other treatments and have been tested and have COVID. CDC yesterday released updated reports on the spread of the variants. We know that their numbers were updated recently as well, readjusted. What I'm sharing with you today is stratified to the Region 3 groups. That includes Delaware, DC, Maryland, Pennsylvania, Virginia, and West Virginia. And what we're seeing now is that Omicron is indeed the most commonly sequenced variant at 58% in our region, with Delta being almost all of the remaining cases currently. This is very similar to what they're seeing across the United States. In the US, it's actually 59% for Omicron, but it's very, very similar what we're seeing in our region. The recommendations for protecting yourself against Omicron, again, are the same as with Delta, and Dr. Burke just touched on, please get your boosters, please get vaccinated, please wear a mask and socially distant. If you are traveling or gathering, you should do testing. There are some requirements for international travel. And again, we're asking people if they're symptomatic, please isolate as long as you're symptomatic, regardless of whether it's been determined it's COVID or something else. We're not looking for any respiratory diseases to be transmitted right now. We have some updates on our vaccination totals. We continue to see we are now, as we reported last week, over 1 million residents in Montgomery County have at least one dose, and 83% of our population has been determined to be fully vaccinated. It's now at 872,273. We continue to see increases with our pediatric populations, which is driving this. The number of boosters that have been identified, boosters and additional doses by county, Montgomery County continues to climb at a significant pace each day, up to 324,627 additional doses in the county. Again, we strongly recommend that people who are eligible come out and get their booster, particularly if you're over 65 or you got the J&J vaccine as your initial dose. Please come out. If you know someone who's over 65 and has not gotten their booster and is eligible, please encourage them to come out. The county executive has covered our pediatric doses. We continue to offer clinics and encourage our 5 to 11-year-olds to come out and be vaccinated to increase the rates of protection amongst them. One thing I know we've gotten a lot of questions about is our testing within the county. We have significantly increased the volume of testing we're doing across our sites. And we continue to, I know this was shared, that increase in last week, that was just in 4 days over the 7 days previously. We are working with some of our county partners on trying to hold testing in larger spaces so we can accommodate more appointments. And that includes this week moving from Dennis Avenue to the Silver Spring Civic Building from Monday to Thursday. We will be doing testing on Friday this week to reduced hours. We'll probably be ending testing around 3 o'clock on Friday, but we do know that there's a large need, and so we're staying open on that day, even though it's a county holiday. We are also operating on January 2nd as well. We know there's challenges even with this increased capacity. There's more demand than what the county sites can provide alone. We are encouraging people to look at the other options through the state testing website. There are lots of other places. Historically, most of the testing is done at private partner sites, but again, we're trying to accommodate as much as we can, but we're trying to also do this safely, which is why we're trying to focus on doing testing with people who have scheduled appointments. At this point, I'd like to turn it over to Dr. Stoddard for his updates.
I'll go ahead and punt on my updates. I think they'll come out through questions, and we'll just go ahead and, I know we got a hard stop today. I'm not sure there's questions.
All right, we'll go to questions. Our first question today is from Rebecca from the Washington Post. And reporters, if you could limit your questions to one, let's get through the first round so that we can get everybody's question in. And if we have time, we can go back.
I just have a quick factual question and an actual question. I'm sorry, Barry, but very, very quickly for Dr. Stoddard. I know that some hospitals in Maryland have declared a crisis level of care. Any hospitals in Montgomery County close to that at this moment?
Not aware, and that'll obviously affect staffing ratios, and they'll cancel electives and things like that. So I think the governor did announce this morning, I think they were moving to the next phase, which means that they will automatically be required to cancel electives. I think that came out a little while ago. At least I'm seeing snippets on Twitter about it. We've been here, so I haven't read all through it. But I expect that some have made those changes. I don't think that any had declared before today, but I expect more will based on the governor's direction.
Got it. And then, sorry, my actual question, Barry. At this point, the DC area, including Montgomery County and then Maryland as well, in terms of case rates and hospitalizations, seem to be doing worse than other states and other regions that were so vaccinated. Sorry, can you guys hear me?
We didn't hear the question. We heard your statement, but we didn't hear the question.
Sorry, my question is, why is this the case given that we're so vaccinated? Why does the DC area and Maryland more broadly seem to be doing worse than the rest of the country?
I can say we're likely finding more cases than many places because of the very significant amount of testing that is occurring. DC released a very significant amount of rapid tests, and they are collecting. They have a portal where their population can report those, and so I think they have a bigger spotlight on trying to find cases, and that is certainly true in our county as well. And I think that's going to inflate the number of cases that we are reporting because we are doing a very significant amount of testing here.
I think Sean is correct in saying that. I think that we're seeing a lot of test-related cases. I would also challenge the notion that we're doing worse. And what I mean by that is because of our vaccination rates, we're not seeing certainly in Montgomery County, we're not seeing the deaths or ICU occupancies, oxygenation requirements, things like that would really tell me that we're going to have more mortality. Obviously, cases aren't. We don't ignore those things because they create continuity of operations issues. They create challenges for hospitals and management. All those things are important. But I think that because of the level of testing and because of our vaccination rates, we may be not going to experience the worst possible outcomes that many other places might.
Okay.
But hospitalizations are at record highs, no?
I think you got to realize there's a couple things with hospitalizations, and Sean talked a little bit about this. There's a lot of testing going on in our hospital facilities. So everyone who's admitted is getting a test, right? So you're detecting people who are in the community that may be incidentally positive when they're, and we can't ignore those things, right? That's important. If they're infected in the hospital, they have to be managed differently in the hospital. They have to be, cohorted and things like that. So it's not to ignore, but I think because so many people are affected in the community, you're seeing that reflected in hospitals. If you look at our data from a volume perspective, meaning how much capacity is being utilized versus how much is left, I think a lot of the capacity deficits are being driven by as much of hospital staffing inavailability, which again, the catastrophic health emergency would help them address by allowing them to bring in licensure. So I think that I think that the data is, I don't want to say misleading, but I think you can look at a slide and not get a complete picture of what the situation is in a hospital by just looking at a slide. I actually spent time calling around to some of my colleagues in hospitals to try and get, as we brought Dr. Burke here to give a little more context of what's actually happening in the hospitals versus just looking at a line chart to say, oh, this tells the whole story of what's happening in the hospital.
All right.
Thanks.
Thank you. Next question is Kate Ryan from WTOP.
Hey, thank you so much for doing this. I wanted to ask about the fire service situation and employee vaccination. You still have segments of the county employees who have not reported their vaccination status. For the fire service, it says 16.9%. Does that have some relation to the surge or the large number of fire and EMS personnel we are finding that cannot report for duty now?
Kate, thank you for the question. And yes, the county dashboard does show our numbers and the vaccination reporting. The vast majority, almost 80%, when Earl and I looked at it earlier this week, of the MCFRS personnel that had tested positive for COVID were vaccinated. So the vast majority of my men and women who are out because of COVID are positive, and a very small percentage are out because of quarantine needs. But again, the almost 80% of those that have tested positive for COVID are vaccinated folks.
Thank you. Are they fully vaccinated and boosted?
Yes, with that chart excuse me, Earl. That chart reflects fully vaccinated folks.
Got it. Thank you
Yes,
very much.
Yeah, and so to answer part of your question too, Kate, we've been talking about this for a little bit. We've actually been submitting those names who have currently not provided us information up to the CRISP system at the state of Maryland. This is a agreement that the county executive worked out with Steve Shue, as an assistant secretary at Department of Health, to allow us to provide them the names that are not on the list. They won't give us back a name for name matchup who's not vaccinated, but they'll tell us by department of these people who did not report how many of them actually appear in our vaccination records. And actually, if you look at fire rescue, according to the CRISP data, and this actually data is about 10 days old at this point, 79.3% are fully vaccinated according to the CRISP system. So if you look and align the number of percentage of cases in vaccinated individuals with the percentage of people vaccinated in fire rescue, the number is nearly identical. And so obviously we've seen, yes, boosting will reduce those. And I do not know of that 79% how many are both eligible for booster and have received the booster from that data. But obviously this, the vaccine mandate, even as it's being suggested by the county council, does not address boosters at this point. So obviously, they're fully vaccinated by the CDC definition at present, and they're still, the rates of infection mirror the rates of vaccination.
Got it. And lastly, you mentioned CRISP. Can you explain what is that? CRISP?
Yeah, CRISP is the Chesapeake Regional Information Sharing Portal, something like that. It's basically a statewide vaccine and other health information tracking system that the state maintains. We can access from public health for various public health purposes, but as an employer, we have not felt comfortable leveraging that public health access to access it for employment record information. So what we've done is, the workaround we've developed is we get a de-identified list back of how many people actually appear in the system who have not identified themselves in the self-reporting mechanism. And so we can tell other people who have not reported how many people are actually statewide designated information. Thank you very much.
Thank you.
So that tells you exactly. So that gives us a little more information than the self-reporting would.
Got it. Thank you. I know others are waiting. Thank you very much.
Thank you. Next up is Steve from Bethesda B.
Afternoon, everyone. Simple question. I feel like on the last couple of weeks on these calls, we've said that we're not at the worst in terms of hospital capacity, in terms of this current surge that we're in. I imagine tracking increasing case counts might be tough to determine, okay, this amount of cases increase equals perhaps more hospitalizations. I guess my main question is, how much more capacity is in the system at this point? As simple as that sounds, and anyone can kind of field that. I know it's probably not an easy question.
It's not an ezy question. I mean, I'd be happy to hear Dr. Burke's opinion, at least a perspective on this too. I would tell you, we've been tracking bed capacity for a long time. And what we've seen is there's been a real, we've disassembled the relationship necessarily between cases and hospitalizations with vaccinations. There's really been a great separation that's been created by vaccinations. So we don't know, early in the pandemic, we knew this many cases, 2 weeks later, we'd see this resulting spike in hospitalizations, but we've seen a spike in hospitalizations, just not the same one-to-one type relationship or one-to-whatever type relationship. So for context, earlier in the pandemic, we were often counting ICU beds to understand just how fast we were getting to that limit of high acuity patients being able to get cared for. And I think the earlier up to stage, when I was looking last week across the system that we track within fire rescue, there were 23 available ICU beds in the region. To give you some context, we were tracking 0 to 6 for a large swath of the earlier part of the pandemic. And so that tells you that there's a substantially greater, it does 23 versus 6, is a big difference. It doesn't seem like a ton of beds, but obviously when you talk about those high acuity patients, we were routinely getting down to 1, 2, 3 ICU beds available in the region. Now we're at 23, so that's obviously better. And so we're tracking that. Now the acute care bed situation is rapidly evolving and on the rise, and so we don't know where that's going to end. But right now there's still fairly good staff bed availability. But obviously the pressure isn't just patients going up, it's staffing going down potentially that drives that staff bed availability. So Dr. Burke, I don't know if you have anything else you want to.
Thank you. And thank you for the question, because this is an area where the numbers don't always tell the complete picture. And locally, what we all responded back to both Maryland Healthcare Association and to the governor is exactly that. There's the total number of beds available, what our ability to surge over our normal bed availability is, and then there is the how many of those beds can we actually staff. And so one of the earlier questions was about how have hospitals declared that they are into a contingency staffing mode or a crisis staffing mode. And many of our local hospitals are rapidly approaching the contingency staffing requirement, which is we can still provide safe care, but we might not be able to do it in the same manner that we're accustomed to doing it. So capacity is getting tight. Surge capacity is going to be even tighter. We do still have critical care capacity. What we are finding locally is that when we need to transfer a patient to a higher level of care, so when we need to access our tertiary care centers in the state, predominantly in Baltimore, it is very difficult to get a bed for that higher level of care.
Thank you.
Thank you, reporters. We have about 6 minutes left, and we have 3 more questions to go. So we have Allie from WAMU.
Hi there. 3 questions in addition to the 2 that I put in the chat. Number 1, I'm sorry, the question's total.
Allie, you get 1 question because we only have.
I already put 2. I put 2 in the chat. So number 1, any plans to distribute more home testing kits? Number 2, still planning to roll back the mandate at 85% vaccinated. And number 3, any language for the vaccine mandate the council is expected to vote on next week that we can review for the resolution.
I can cover all 3 pretty quickly. So as the county executive alluded to in his opening comments, we did order a large shipment of about 1 million home-based kits. We're expecting the first bit of those to arrive. I don't want to quote a day because it's a delivery process that we don't control, but next week. I would guess we're going to probably have upwards of 300,000 at some point next week, distributable kits. We're going to target those through a number of distribution routes that we've talked about, but also including the school system and other large scale opportunities for people to pick them up. We don't want to keep them in a warehouse. We're going to get them out as quickly as possible. As far as the mask mandate, Dr. Bridgers did make a recommendation to the county council yesterday that we will review with them next week, that we postpone the 85% requirement to lift the mandate, but that we have an opportunity at the end of January, along the lines of what DC, Baltimore County has announced around January 31st, to revisit and review that process, whereby the council could then make a different decision about when to alter the current policy. Now, they obviously will have to act on that, but that's the recommendation that we put forward, is a suspension of the 85% with a end of month review period in January. And then the final question was the vaccine passport. We are in the process of finalizing that language for sending over to the county council. My thought process is we'll probably send it over later today. We did have a meeting with the Restaurant Association yesterday to hear some of their feedback and comments and concerns. We expect a little bit more of that today, but then we will incorporate what we can from their concerns into the language. It largely mirrors what DC has done with very few exceptions, and those exceptions are largely clarifications that are done in the proposed language. But I expect the county council will receive it later today, unless something changes, and that would be they'll push it back till tomorrow.
All right, Suzanne from Montgomery Media.
Hi, thanks. Mr. Elrich, I was just wondering if you can point to a reason or why you think Silver Spring seems to be the site of all of the increased violence.
Well, it's not the exclusive domain of increased violence. We've had incidents around the county, so I will not say it's the only one, but I do think that we have very fluid borders. You know, when I was on the city council in Tacoma Park, one of the things that we talked about even back then was the problem with sharing a border with 3 different jurisdictions, where a person could cross very quickly go from one jurisdiction to another. That seemed to be an attractive nuisance, and it may be part of this. Another factor is the way we report things in Montgomery County. Pretty much everything from Burtonsville to actual Silver Spring to Wheaton and beyond is part of what we call Silver Spring. And so there's no distinction between something that happens, say in Burtonsville or Fairland or anything else. It all becomes a Silver Spring story in the Silver Spring report. And that's kind of frustrating for some people because it doesn't really give you an idea that things are actually more dispersed than the way they are. And, you know, Silver Spring is more urbanized in some ways than other parts of the county on the east side. It's certainly more urbanized than Wheaton is. It has higher concentrations of people. It has, more activities going on, more nightlife going on. So, we have a number of different things that contribute. And, one of the things that people would talk about was people coming in to Silver Spring very late at night after things had closed in the district and finding places open in Silver Spring. They most likely should not have been open, and we're going to work. It's one of the issues we're raising with the state in terms of where we can enforce and can we get authority to enforce some rules locally. So I think there are a number of different things at play here.
Great, thank you.
All right, we have one more question before I get to it. Mr. Executive, could you be okay with the waiting on the last question, or do you need to go? I have
a 1:30 stop because I'm supposed to be in another meeting at 1:30.
Okay. All right. So
if we can, if it's not
question, can you hang around, Dr. Stoddard?
Yeah.
Okay.
Okay. I'm going to jump off then you guys can handle the last one.
Okay.
Okay.
Thank you, County Executive.
Thank you.
Thank you, Dr. Burke. All right, Matt from WTOP has a question.
Yeah, you guys can hear me, correct?
Yep.
Yeah, so somebody already answered the first part of my question, so I just wanted to add on that with so many cases occurring in fully vaccinated people now, does that challenge the need at all to check for vaccination status at these businesses? The idea that was floated, I should say, of checking vaccination status at the businesses.
Well, so if you look at the CDC data, your probability of being infected and your probability of severe outcomes does stratify based on unvaccinated to vaccinated plus boosted. And so I don't think it eliminates the need. It certainly makes those spaces safer. You're 100%, it's basically, the point is, if you're outside and it's raining, you may get wet. You're less likely to get wet if you're have an umbrella, but you still may get wet. And so we're essentially saying that, for those businesses, you have to have the umbrella to participate. And so I don't think that it eliminates the need. It certainly, may evolve it to eventually require boosters, but I think that's a more likely possibility than to say to eliminate the need altogether, because the data is clear that being vaccinated is better than being unvaccinated and more protective. It just may not be as protective as, boosting requires.
Just to clarify, the potential mandate could eventually require someone getting a booster as well to be allowed to enter a certain business?
It's not going to be in the base resolution, but certainly what we've said, there's a few things that aren't going to be in the base, what we propose to the council, that when we implement, we will evaluate, and that may be one of those things that gets considered in the future. Similarly, we're talking about the mechanisms for validating vaccination. Right now, I think we're going to plan to send over something that it says, your vaccine card or a picture of your card is totally sufficient. In other places, they've required that you have your card and a photo ID. We're not going to likely do that in the beginning, but if we see enough problems over the course of implementation, assuming the county council acts on this, we might later come back and revisit. Similarly, I think we would look for, are there issues with limiting it to 2 doses at this point, and do we need to revisit it later to potentially consider boosters as well? I think that's true in every setting, though. For example, I think that CDC's definition of fully vaccinated may well shift over the coming weeks and months, at which point we would obviously have to revisit a lot of things within county government for how we make determinations on whether someone is fully protected or not.
And just to chime in for my colleague, both the vaccine mandate and the mask mandate will be taken up by the Board of Health on January 4th. Is that correct?
I don't know. Well, I expect they will address the vaccine mandate on the 4th, because obviously if they don't, the 85% will be reached sooner or later. I do not know whether they intend to take up the vaccine passport question at that time frame, or they'll wait until the next council session on January 11th. That'll be obviously at the discretion of the council to determine when they take it up.
Awesome. Thank you, Doctor.
You're welcome.
Okay, any more questions from reporters before we sign off?
I'll hop in here, Barry, with one. Given the CDC's kind of new updated guidance on isolation periods, wondering how quickly that can be implemented, given the news out of the fire service yesterday, if that's going to be implemented right away. I know when I talked to Chief Goldstein, Dr. Stoddard might be able to answer that, or anyone on the public health team, but I'm wondering how quickly that might impact service, because that's obviously an interesting kind of change that affects that whole situation.
Yeah, I have a few comments on this. So first off, Maryland Department of Health has put out a statement saying they're going to evaluate and make recommendations to the state. And I think we're going to wait to make any broad